Hey guys, Dr. Ray Marquez here, your local chiropractor down in Murrells Inlet at Back Pain Relief Center. We have Julie with us today, and she's been complaining of a headache. And chiropractors can help with some headaches. There's some they can't, but with this particular one, we're going to give it a shot because Julie has a bunch of myospasms or trigger points up in her upper trapezius or lower neck, and has some trigger points up here in her cervical spine. We're going to try to get those to reduce or calm down a little bit or break up some of those adhesions to possibly take some pressure off her neck that may be contributing to the headaches. One of the things that we'll do first is we're going to use one of our lasers that we have, and it's a cold laser, and we'll use that on her, and we'll put the laser right through the muscle knots there in order to break those adhesions up, to loosen the muscle up, to get some blood flow in there, and to get to hopefully reduce some of the pain. I'm not going to film that part of it because when we do use the cold laser, which we have a lot of success with, but we have to do it about 5 minutes or so on each trigger point, so it's a little time consuming. So for the sake of the video, I won't show that part of it. So we'll go through all the muscle work and then the adjustment, and we'll go from there. Okay? So I'm going to have you spin around this way first. So maybe you want to come around this way. And what I'm doing is I'm putting some pressure on her neck, and they're the trigger points or the tight muscles, and we're going to ask her to go through a range of motion that will hopefully break up some of that. Okay, so look down to your chest and up. So big pull, 1, and up. 2, 3, 4, 5. Good. Turn your head to the right and go up and down for me. 1, 2, 3, 4, 5. Okay, other side. 1, 2, 3, 4, 5. Now rotate your head this way. 1. That's we're just going to rotate it. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. Now we're just going to have you bend your head for me 5 times. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. So what I did there is try to break up those muscle knots in her upper trapezius to try to decompress the spine, loosen things up, get some better range of motion. All right, so let's go face down for me. I'm going to come on over here. So this is an adjusting instrument that I use, and what it's designed to do is just decompress each one of these spinal joints, which will relieve some pressure, allow the nerves to work the way they're supposed to. For my patients that don't want to get their necks manually manipulated or cracked, this is the best way to do it because we can get the same outcome just by using the instrument. Okay, let's go in your back. So we're going to do a manual manipulation of her neck. We'll do it 2 different ways. So first, bend your feet for me. And we're just going to long axis or traction her neck out. And just nice and light. Okay. Now we're going to do manipulation, which we're going to realign the spine, decompress it, and allow it to work freely. Let's drop. And come back up. We're going to send the leg to the table. Next, we're going to do an upper thoracic manipulation, which is closely related to the neck, relieves a lot of pressure. All right, so that's it for the adjustment. What we're going to do next is do the laser that we talked about. We may even do some heat and some stim on our upper back to try to get it to feel a little better. I hope that helps. If you have any questions, please leave me a comment, and we'll talk to you soon.